population that we're going to be discussing today is opioid addictions. So the opioid epidemic is a crisis that affects public health as well as economic welfare. An estimated 1.7 million people in the U.S. suffer from substance abuse disorders related to prescription opioid painkillers. Of these 1.7 million, more than 46,000 will die annually of overdose. Every year, 191 million opioid prescriptions are written. Of the people prescribed opioids, 21 to 29% will misuse them. Between 8 and 12% will develop opioid addiction. According to the National Institute on Drug Abuse, influences from family and friends to economic status and general quality of life will have an effect on a person's likelihood of becoming addicted to opioids. Factors such as peer pressure, physical and sexual abuse, early exposure to drugs, stress, and parental guidance can greatly affect a person's risk of drug use and addiction. Environmental factors impeding optimal health for people recovering from opioid addiction in the community include lack of resources, lack of support systems, social exclusion and isolation, and widespread availability of prescription opioids.
One person in recovery from addiction stated, "Everyone I knew had a prescription." Although the number of new prescriptions for opioid painkillers has dropped since its high rise in the 1990s, opioids are still widely believed in the medical community to be overprescribed. Many teenagers develop primary addiction from opioids that they find in the cabinet at home, since people often do not finish long prescriptions of painkillers. Many people addicted to opioids do not have access to treatment at all. For people who do receive treatment, there are often no next steps after inpatient rehab. They are released back into the same situation they're left with no resources to avoid falling into the same pattern. As one person in recovery stated, "You don't just get clean and your life is suddenly all put back together."
As the opioid crisis worsens each year, so does the stigma against people facing addiction. In towns where police respond to overdoses often, body cam videos are sometimes released of overdoses the police respond to. One such video showed two parents overdosed in the front seat of their cars with their children still strapped into car seats in the back. This leads to public outrage and a decrease in sympathy for people dealing with opioid addiction. The opioid crisis has primarily affected the rural white population in the United States. This is a population that pharmaceutical companies marketed opioids to most heavily in the 1990s, when opioids were believed to be a new, risk-free wonder drug for chronic pain. This is also the population who has paid the highest price. Non-white people have been much less affected by the crisis, possibly because they were not prescribed opioids at the same rate as whites. The New York Times speculated that this discrepancy in prescription was because doctors either believed their black patients would be more likely to become addicted to opioids, would be more likely to sell the drugs, or that they had a biologically higher pain threshold than white people, and so didn't have as high of a need for the drugs. These biases against black recipients of healthcare have been noted previously, but this is a rare occasion of the black community actually being protected by the bias. Since they were prescribed fewer opioid painkillers, black patients were less likely to become addicted, although they were more likely to endure unnecessary and sometimes excruciating pain for illnesses like cancer. For young people, the risk of forming a new addiction to opioid prescription drugs is high. This risk can be mitigated through programs such as Truth, which advertises the risks of opioid use to teens and has proven to be very successful. The Truth campaign, which resulted in huge reductions in the number of teen smokers when it was introduced in the 1990s, has recently begun anti-opioid campaigns in states with high rates of addiction. The risk of primary addiction can be mitigated by a reduction in the number of prescriptions written for opioids as well, and the development of alternatives to opioid drugs for chronic pain.
A biopsychosocial approach is shown to be the most effective method for promoting positive youth development and resilience that focuses on developmental competencies. Life skills training, such as teaching middle and high schoolers drug awareness and self-management, social and resistance skills, can help prevent addiction in young people. Community-level interventions initiatives are effective in increasing social support in communities. Addressing adverse traumatic childhood experiences through a neighborhood school-based community policing strategy can also help prevent traumatized children from becoming addicted as they get older. Addressing modifiable childhood and adolescent risk and protective factors such as these may be another way to make a difference. Risk of relapse can be mitigated by the development of programs that bridge the gap between inpatient treatment and help patients develop skills for coping with sobriety in their natural environments. The risk of relapse after inpatient rehab can be increasingly high. It can be reduced by the strengthening families approach. Additionally, we can use overdose prevention and increase access for treatment to addiction.